Hello everyone, here I am going to talk about the anatomy of fourth ventricle. This is the lateral view of the brain. Here this is the supralateral surface of the cerebral hemisphere. This is a frontal lobe. Here there is the parietal lobe. This is the temporal lobe. Here this is the occipital lobe. Then posteriorly here this is the cerebellum. This anteriorly you can see this is the pons and the medulla. Above the pons there is the midbrain there. Okay, it's embedded by this temporal lobe. Then you can see posteriorly here this is the cerebellum. Anterior to the cerebellum there is the pons and the medulla. This forms the hindbrain. So the cavity between the cerebellum and the pons and the upper of the medulla, that is the fourth ventricle. So the cavity of the hindbrain is this fourth ventricle. So posterior-superiorly you can see there is the cerebellum which forms the roof. Then antero-inferiorly there is the pons and this upper part of the medulla. Here this forms the floor of the fourth ventricle. So between here there will get the fourth ventricle. Then here this is the sagittal view. So this is the cerebral hemisphere, medial surface. Then here this is the corpus callosum, the septum pellucidum. Here this cavity, this is the lateral ventricle. Here in the middle there is the thalamus, is the hypothalamic area. This is the hypothalamic sulcus. Here there is the third ventricle. Here this is the brain stem. This is the midbrain, pons and the medulla. Here there is the cerebellum. Here this cavity here, this is the fourth ventricle. Okay. So this is the fourth ventricle. So anteriorly there is the pons and this medulla, upper part of the medulla. This area forms the floor. Posteriorly, here posteriorly you can see here, this is the superior medullary velum. Here we'll get the inferior medullary velum. This area forms the roof of the fourth ventricle. Here this cavity, here there is the third ventricle. This third ventricle communicates with this fourth ventricle through the cerebral aqueduct here. This fourth ventricle here, it is communicates through the central canal of this medulla. That one is communicating with the central canal of the spinal cord. Okay. Then in this figure, this is the cerebellum. Okay, this is cerebellar hemispheres. This part is the vermis. So they made a cut through the vermis. Okay. Here this is the medulla. Here we'll get the pons. Then you're seeing this cavity here. This one is the fourth ventricle. So this area forms the roof. Here this area forms the floor of the fourth ventricle. So this is the roof. Here there is the floor. Then so in this diagram of the specimen, you can see this is the posterior dorsal aspect of this brain stem. Here this is the pons, this is the medulla, this is the open part of the medulla. They removed this cerebellum. So here you can see here, okay, here this is the superior cerebellar peduncle which connects this midbrain with the cerebellum. Here we'll get the inferior cerebellar peduncle which connects this medulla with this cerebellum. So the superior and this inferior cerebellar peduncle forms the supralateral and infralateral boundaries. Okay. Between the superior cerebellar peduncle you can see this area here. This is the superior medullary velum. Here that forms the roof of the fourth ventricle. Yes. Here this cavity is the fourth ventricle. But you're seeing here this area that forms the floor of the fourth ventricle. Then here in this sagittal view, this already explained. This is the medial surface of the cerebral hemisphere. You can see here this is the midbrain, pons and the medulla. This is the cerebellum. This is the vermis of this cerebellum. This is the cerebellar hemisphere. The stent shaped here, this cavity. That is the fourth ventricle. Here, posteriorly, this is the superior medullary velum. Here, there is the inferior medullary velum. This forms the roof of the fourth ventricle. See, this is the sagittal view. Okay, here, this pons and the medulla here, this area forms the floor of the fourth ventricle. Yes. Coming to this diagram, here there is the pons medulla. This is towards anteriorly. This is the cerebellum towards posteriorly. Here the stent shaped this cavity. This is the fourth ventricle. Here you can see the roof. This is the superior medullary velum. It's a nervous tissue which is going to this white core of this cerebellum. Okay, to this white matter of this cerebellum. Then here this area, this is the inferior medullary velum. So this inferior medullary velum is made up of non-nervous tissue. This is superior medullary velum. It's a nervous tissue. Okay, it is going to this white core of this cerebellum. Inferior medullary velum is marked with this green. That is a non-nervous tissue. It is the pia mater. It is the double layer fold of the pia mater, inner layer of this meninges. Okay, here this is the ventral layer towards anteriorly. Here this is the dorsal layer of the pia mater, which lines this vermis and then lines this cerebellar hemispheres. Okay, here then so this is the pia mater ventral layer. This is the dorsal layer. Then here the ventral layer here anteriorly, it also here lines this medulla. Okay, then here you can see this is the arachnoid matter. Yes, here you can see this is the arachnoid matter. This is the pia mater. Here there outer to that there is the arachnoid matter. So between this arachnoid matter and the pia mater, this is the subarachnoid space. So this is the last space here. This is called the cerebellomedullary cistern. Okay, the space here, this is called the cerebellomedullary cistern, cerebellum, and this medulla. Pia anterior layer of this pia mater is reflecting towards this medulla. Okay, so this space here, this is called the cerebellomedullary cistern or the cisterna magna. Okay, then here you can see there is the choroid plexus are there. They will get the choroid plexus. Okay, so this double layered fold of this pia mater, here this cavity is lined with ependymal cells. Okay, that togetherly forms the Tela Choroidea. Okay, that is togetherly forms the Tela Choroidea. Okay, Tela Choroidea is this double layered fold of this pia mater with this ependymal cells forms this Tela Choroidea. Okay, actually this inferior medullary velum is made up of this Tela Choroidea. Okay, this is a superior medullary velum. It is a nervous tissue. Okay, this superior and this inferior medullary velum forms the roof. Cisterna magna is this subarachnoid space between this pia and this one arachnoid matter here. Okay, it's also called the cerebellomedullary cistern. Okay, so the CSF is there in the fourth ventricle, is coming out to the cisterna magna through one foramen is there here. This foramen is called the foramen of Magendie. Here we'll get one foramen in this double layer fold of the pia mater medianly, that is called the foramen of Magendie or this median aperture. Through that opening, the CSF in this fourth ventricle is coming out to the cisterna magna. Yes, in this figure you can see there is the Tela Choroidea clearly. Okay. So here this is the superior cerebellar peduncle. Okay, here there is the inferior cerebellar peduncle. This forms the supralateral and this infralateral boundary. Additional to this inferior cerebellar peduncle, you can see this is the closed part of the medulla. Here there is ends with here. This is the gracile and this cuneate tubercles. This is the gracile tubercle. This is the cuneate tubercle. Beneath lies this gracile and the cuneate nucleus respectively. This also comes under this infralateral boundary. Okay, this is the supralateral boundary, superior cerebellar peduncle. Okay, here you can see this purple color. This is the Tela Choroidea. That is the double layer fold of the spare matter. Okay, there you can see there is the choroid plexus is there. This fringe like tuft of capillaries here. This forms the choroid plexus. See, there is a T-shaped. Okay, this choroid plexus. Here, this capillaries here, it is from this inferior cerebellar artery, posterior inferior cerebellar artery, this one. Here, the laterally here, this one is choroid plexus sometimes, which comes out through one foramen here. This is the foramen of Lusca. Here we'll get the laterally. This foramen is called the foramen of Lusca. Here there is, it communicates here outside through the cisterna pondine cistern. Here I'll get the pondine cisterns. Here there is this foramen here is called the foramen of Magendie. Here it communicates with this cisterna magna. Okay, this is the subarachnoid space. Here, back to this diagram here. In relates to this fourth ventricle, there are some recesses are there. Recesses means these are the blind diverticula. Okay, here there will get the lateral recess on each side towards laterally. Here we'll get one lateral recess like that here. Okay, so this lateral recess here will get foramen there. Okay, that foramen is called the foramen of Lusca. We have seen in this previous figure. This is the foramen of Lusca. Okay, here this one, this CSF in this cavity communicates through this pondine cistern outside. Okay, it relates to the pondine cistern. Okay. Then yes. Okay, in this figure you can see here there is the lateral recess is there. So this is the ventral aspect of this medulla and the pons. This is posteriorly here there is the cerebellum. This is the flocculus of the cerebellum. Here this is the pyramid, olive. This is the inferior cerebellar peduncle. Between this inferior cerebellar peduncle and this flocculus here, you can see one foramen here. This is the foramen of Lusca, which leads into inside to the lateral recess. That is here, in between here, it is entering to this fourth ventricle. Okay, so this is the foramen of Lusca. So CSF is communicating with this pondine cistern. Okay, here we'll get the pondine cistern. Then, in this figure, you can see this is the dorsal aspect of this medulla. This is the closed part of the medulla. Here there is the open part of the medulla. This is the pons. Here, this pons and this upper part, that is the open part of this medulla, forms the floor of the fourth ventricle. Okay, here I am seeing this is the floor of the fourth ventricle. Here this is the superior cerebellar peduncle. This is the superior medullary velum. Here there is the inferior cerebellar peduncle is there. Then here this is the superior medullary velum. Here this is the inferior medullary velum. This one here. Okay. This forms the roof here. This forms the roof. This forms the floor. Here you can see this it forms the lateral boundaries. Okay. So in this figure, you can see there is the superior and this inferior medullary velum. Here, this is the worm is there. Here it is reaching to one recess there. Okay, here I'll better show in the sagittal view. Yes, in this figure, in the sagittal view, you can see here this is the superior medullary velum, this is the inferior medullary velum, this is the fourth ventricle. Here there is one recess, this is the median recess. That one is the median recess. Okay, we have seen the lateral recess. Here we'll get the lateral recess. Okay, then back to the features of the floor. So this shape here, this is a rhomboid in shape, so it's also called the rhomboid fossa. Then in the middle, median, you can see there is a median sulcus is there, okay, which divides this floor into equal halves. Okay, then lower here, lower 1/3, this is the striae medullaris here. This one is the striae medullaris here. Then which divides this floor here into this upper large triangular area and lower smaller triangular area, the striae medullaris. So this striae medullaris here, these are this transversely running white fibers, okay, which arises from the arcuate nuclei, which is located at the pyramid. Okay, from there it decussates, then it goes to the cerebellum through the inferior cerebellar peduncle. Okay, this striae medullaris. Then in the lower part, you can see here upper this triangular area, this elevation, that is the hypoglossal triangle. Okay, deep to that lies the hypoglossal nuclei. It's a motor nuclei. Then lower to that, this elevation here, this triangular area, that is the vagal triangle. Deep to that lies the dorsal nuclei of the vagus. That one is the parasympathetic nuclei. Then here in this upper part here, there is the median sulcus. This elevations here, this forms the median eminence. Okay, on each side of the median eminence, you can see there is a lateral sulcus is there. So the sulcus is extends towards the lower part. This is the sulcus limitans. That is the sulcus limitans. The upper of the sulcus limitans, there is a depression here. There will get the superior fovea here on each sides. The lower of the sulcus limitans, this depression here, this is called the inferior fovea. Here I will get the inferior fovea. Here there is the superior fovea. Okay, the superior fovea here, above the superior fovea, you can see this bluish area, that is called the locus ceruleus. That is called this locus ceruleus. Okay, then below this median eminence, there is a round elevation there. This is called the facial colliculus. Okay, this facial colliculus is due to the winding of this facial nerve fibers. Okay, facial nerve, this is a motor fibers, which winds round this abducent nuclei. This is abducent nerve nuclei. This is facial nerve here. This facial nerve fibers winds round this abducent nerve nuclei. This one, this winding, this projection, okay, that you can see over dorsal aspect, that's elevations, that is called the facial colliculus. Okay, then lateral to that here, this area, this lateral area here, this is called the vestibular area. Vestibular area here is a vestibular area, that is a sensory area. These are the important features you can see on this floor of the fourth ventricle. Okay, here this is the superior cerebellar peduncle, this which connects this midbrain with the cerebellum. Here you can see this is the middle cerebellar peduncle, which connects this one pons with the cerebellum. Okay, here there is the inferior cerebellar peduncle, which connects this medulla with the cerebellum. So this part here, this is the dorsal aspect of this midbrain. Here you can see there is the superior paired and inferior collicula is there. Then in this figure, the specimen of this floor of the fourth ventricle. So you can see this is the dorsal aspect of the brainstem. This is the midbrain here. There is the pons. This is the medulla. Here you can see this is the superior and this is the inferior colliculae. This is the superior cerebellar peduncle. This is the middle. Here you can see there is this is the inferior cerebellar peduncle. Okay, this shape here floor, that is the rhomboid in shape, so it's also called the rhomboid fossa. Here you can see there is a median sulcus, facial colliculus, median eminence, striae medullaris. There you can see the hypoglossal triangle, and here there is the vagal triangle. Okay, that's all about this boundaries and features of this floor of the fourth ventricle. Okay. Here, back to the sagittal view. So this cavity of this hind brain, that is called the fourth ventricle. Here anteriorly, here you can see anteroinferiorly, there is a pons and upper part of the medulla that forms the floor. Here posterior superiorly, you can see there is a superior medullary velum, inferior medullary velum that forms the roof of this fourth ventricle. Here this fourth ventricle communicates with this third ventricle here through the cerebral aqueduct. Okay, here you can see in this midbrain. Then fourth ventricle communicates with this here medulla here through the central canal, then through the central canal of this spinal cord. Yes, here is the question. Describe the floor of the fourth ventricle. Okay, that's all. Thank you.